Introduction to phobias. Phobias are intense, irrational fears of specific objects, situations, or activities. These fears can be so severe that they interfere with daily life, causing significant distress and anxiety. Phobias can develop as a result of a traumatic experience, but they can also be learned through observation or taught by others. Phobias can be classified into three main types: specific phobias, social phobias, and agoraphobia. Specific phobias are fears of specific objects or situations, such as fear of heights, spiders, or flying. Social phobias involve intense fear of social situations or performance, such as public speaking or meeting new people. Agoraphobia is a fear of being in situations or places where escape might be difficult or impossible. Phobias can be treated with various therapies, including exposure therapy, cognitive behavioral therapy, and medication. It's essential to seek help from a mental health professional if a phobia is interfering with your daily life. Definition of phobia. A phobia is an intense and persistent fear or anxiety of a specific object, situation, or activity that is out of proportion to any actual danger posed by the object or situation. It is considered a type of anxiety disorder and can cause significant distress and impairment in daily functioning. The fear or anxiety associated with a phobia is often irrational, and the individual may go to great lengths to avoid the object or situation that triggers their phobia. Facts about phobias. Here are some facts about phobias. Phobias are a common mental health disorder, affecting around 8 to 10% of people at some point in their lives. Phobias can develop at any age, but they often start in childhood or adolescence. Specific phobias are the most common type of phobia and can be related to animals, heights, enclosed spaces, flying, and other objects or situations. Social phobia, also known as social anxiety disorder, is a fear of being judged, evaluated, or rejected in social situations and affects about 6.8% of the population. Agoraphobia is a fear of being in situations where escape may be difficult, such as crowded places or open spaces, and affects about 1.7% of the population. Phobias can interfere with daily life and lead to avoidance behavior, which can further exacerbate the phobia. Phobias can be treated with cognitive behavioral therapy, exposure therapy, and medication. Exposure therapy is a type of therapy where a person is gradually exposed to the feared object or situation in a controlled and safe environment to help them overcome their fear. In some cases, medications such as antidepressants or beta blockers may be prescribed to help manage symptoms of anxiety related to phobias. With proper treatment, many people with phobias can overcome their fears and improve their quality of life. The causes of phobias are not fully understood, but they are thought to be a combination of genetic, environmental, and psychological factors. Here are some possible causes of phobias. Genetics. There may be a genetic component to phobias, as they tend to run in families. However, specific genes related to phobias have not been identified. Traumatic experiences. Phobias can develop after a traumatic event, such as a car accident, natural disaster, or assault. The fear may be a result of associating the traumatic event with a particular object or situation. Learned behavior. Phobias can be learned through observing others fear or being told to fear a specific object or situation. Anxiety sensitivity. People who are prone to anxiety or have a high level of anxiety sensitivity may be more likely to develop phobias. Brain chemistry. An imbalance in brain chemicals such as serotonin and dopamine may contribute to the development of phobias. Personality traits. Certain personality traits, such as neuroticism or a tendency to worry, may increase the risk of developing phobias. Environmental factors. Phobias can develop as a result of environmental factors such as a lack of social support, stressful life events, or childhood abuse. Types of phobias. There are three main types of phobias. Specific phobias. These are the most common type of phobia and involve an intense fear of a particular object, situation, or activity that is out of proportion to the actual danger posed by the object or situation. Examples of specific phobias include fear of spiders, snakes, heights, flying, and enclosed spaces. Social phobia, also known as social anxiety disorder. This type of phobia involves an intense fear of social situations or performance, such as public speaking, meeting new people, or eating in public. People with social phobia may fear being judged, criticized, or humiliated in social situations. Agoraphobia. This type of phobia involves an intense fear of being in situations or places where escape might be difficult or impossible. This can include crowded places, open spaces, or situations where the person feels trapped, such as using public transportation or being in an elevator. Clinical features of phobia. The clinical features of phobia can vary depending on the type and severity of the phobia, but common symptoms may include intense fear or anxiety. People with phobias experience an overwhelming sense of fear or anxiety when they encounter the object or situation that triggers their phobia. Panic attacks. In some cases, exposure to the phobic object or situation can trigger a panic attack, which is characterized by symptoms such as heart palpitations, sweating, trembling, and difficulty breathing. Avoidance behavior. People with phobias often go to great lengths to avoid the object or situation that triggers their fear. This can interfere with daily life and lead to social isolation or difficulty completing tasks. Physical symptoms. Exposure to the phobic object or situation can cause physical symptoms such as rapid heartbeat, sweating, nausea, and trembling. Emotional distress. Phobias can cause significant emotional distress and may lead to feelings of shame, embarrassment, or guilt. Interference with daily life. Phobias can interfere with daily life and lead to problems in relationships, work, and other areas of life. Avoiding phobias. While it may be difficult to completely avoid the object or situation that triggers a phobia, there are some strategies that may help people manage their phobia symptoms. Gradual exposure. Gradually exposing oneself to the phobic object or situation, starting with less intense exposure and increasing the level of exposure over time, can help desensitize a person to their fear. Relaxation techniques. Practicing relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation can help reduce anxiety and calm the body. Cognitive behavioral therapy. A type of therapy that involves identifying and challenging negative thoughts and beliefs that contribute to phobia symptoms, and learning coping strategies to manage anxiety. Medication. In some cases, medication may be prescribed to help manage phobia symptoms, such as anti-anxiety medication or beta blockers. Support groups. Joining a support group for people with phobias can provide a safe space to share experiences and learn coping strategies from others. Treatment of phobia. There are several effective treatments available for phobias. Cognitive behavioral therapy, CBT. This type of therapy involves identifying and challenging negative thoughts and beliefs that contribute to phobia symptoms, and learning coping strategies to manage anxiety. Gradual exposure to the phobic object or situation is often a key component of CBT. Exposure therapy. Exposure therapy involves gradually exposing a person to the phobic object or situation, starting with less intense exposure and increasing the level of exposure over time, until the fear response diminishes. Virtual reality therapy. Virtual reality therapy uses computer-generated simulations to create a realistic and safe environment for exposure therapy. This can be particularly helpful for phobias involving situations that are difficult to recreate in real life. Medication. In some cases, medication may be prescribed to help manage phobia symptoms, such as anti-anxiety medication or beta blockers. Relaxation techniques. Practicing relaxation techniques such as deep breathing, meditation, or progressive muscle relaxation can help reduce anxiety and calm the body.